Hi, this is Mohammed Arhum Saeed, student of International Medical University, 4th semester GMM 29. Today I am going to explain the effects of drugs on osteoporosis. So we will start with the basic term osteoporosis. So what is osteoporosis? Osteoporosis is a health condition that weakens bones, making them fragile and more likely to break. It develops slowly over several years and is often only diagnosed when a fall or sudden impact causes a bone to break. So we know that bone is a mineralized connective tissue that exhibits four types of cells, which are osteoblasts, bone lining cells, osteocytes, and osteoclasts. Bone exerts important functions in the body such as locomotion, support and protection of soft tissues, calcium and phosphate storage, and harboring of bone marrow. Bones are mostly made of protein collagen, which forms a framework. The mineral calcium phosphate hardens this framework, giving it strength. More than 99% of our body's calcium is held in our bones and teeth. So people with osteoporosis do have some common injuries such as they got their broken wrist broken, hip broken, and spinal bones broken. However, breaks can also happen in other bones such as in the arm or pelvis. Sometimes a cuff or sneeze can cause a broken rib or the partial collapse of one of the bones of the spine. So we got the idea that due to osteoporosis, bones become too weak that even a cuff or sneeze can cause the bone to break. Osteoporosis is not usually painful until a bone is broken, but broken bones in the spine are common cause of long-term pain. Although a broken bone is often the first sign of osteoporosis, some older people develop the characteristic stooped posture. It happens when the bones in the spine have broken, making it difficult to support the weight of the body. Losing bone is a normal part of aging, but some people lose bone much faster than normal. This can lead to osteoporosis and an increased risk of broken bones. Women also lose bone rapidly in the first few years after the menopause. Women are more at risk of osteoporosis than men, particularly if the menopause begins early, before the age of 45, or they had their ovaries removed. However, osteoporosis can also affect men, younger women, and children. Many other factors can also increase the risk of developing osteoporosis, which are taking high dose steroid tablets for more than 3 months, other medication such as inflammatory conditions, hormone related conditions, or malabsorption problems. A family history of osteoporosis, particularly a hip fracture in a parent, long term use of certain medicines that can affect bone strength or hormone levels, such as anti-estrogen tablets that may women take, having or having had an eating disorder such as anorexia, having a low body mass index. Many diseases and disorders have been associated with osteoporosis. For some, the underlying mechanism influencing the bone metabolism is straightforward, whereas for others, the causes are multiple or unknown. Hypogonadal states can cause secondary osteoporosis, women estrogen deficiency, men testosterone deficiency. Endocrine disorders that can induce bone loss include Cushing syndrome, hyperparathyroidism, hyperthyroidism, hypothyroidism, diabetes mellitus type 1 and 2, malnutrition, parental nutrition, and malabsorption. People with rheumatological disorders such as rheumatoid arthritis, ankylosing spondylitis, systematic lupus erythematosus, and polyarticular juvenile idiopathic arthritis. Chronic kidney diseases can lead to renal osteodystrophy, hematological disorders, several inherited disorders. So here we got a picture explaining the difference between normal bone matrix and osteoporosis. So we can get the idea that normal matrix is thick, and whereas osteoporosis bone is thin. Osteoporosis occurs when bones lose minerals such as calcium more quickly than body can replace them, leading to a loss of bone thickness. As a result, bones become thinner and less dense, so that even a minor bump or accident can cause serious fractures. These are known as fragility or minimal trauma fractures. Two-thirds of fractures of the spine are not identified or treated, even though they nearly all cause pain and some disability. Osteoporosis can be easily diagnosed on special type of X-ray known as DEXA scan. This machine determines bone mineral density, bone So there are two terms, osteopenia and osteoporosis. Normal bones are known as osteopenia. The term used for normal bones is osteopenia, and the term used for the bones that are not normal are osteoporosis. So we will now discuss the effects of drugs on osteoporosis. There are six types of drugs: biophosphonates, monoclonal antibody medications, hormone related therapy, parathyroid hormone, calcitonin, calcium, and vitamin D. So, biophosphonates include clodronate, alendronate, ibendronate, zoledronic acid. Monoclonal antibody medications include denosumab, romosumab. Hormonal related therapy includes raloxifene, testosterone. Parathyroid hormone includes teriparatide, abaloparatide. Calcitonin, which is miacalcin, and calcium and vitamin D supplements. So biophosphonates. There are three generations of biophosphonates: first generation, second generations, and third generation. First generation biophosphonates are medronate, clodronate, atidronate, and tyludronate. Second generation biophosphonates are aminobiphosphonates, which are alendronate and pamidronate. These contains a nitrogen group in the side chain. These are 10 to 100 times more potent than the first generation compounds. So then we have third generation biophosphonates. These are risidronate and solidronate. These contain a nitrogen atom within a heterocyclic ring or are up to 10,000 times more potent than the first generation agents. So then we have monoclonal antibody medications. These includes Prolia. Prolia is an anti-resorptive rank ligand inhibitor, and its mechanism is an essential mediator of osteoclast activity. Increased rank ligand may lead to increased bone loss. Prolia targets and binds rank ligand, inhibiting osteoclast formation, function, and treatment of postmenopausal women survival. Osteoporosis at high risk for fracture, treatment to increase bone mass in men with osteoporosis. So Prolia is basically used for the treatment to increase bone mass in men with osteoporosis, treatment of glucocorticoid induced osteoporosis, treatment of bone loss in men receiving androgen deprivation therapy for prostate cancer, and it is also used for the treatment of bone loss in women receiving adjuvant aromatase inhibitor therapy for breast cancer. So Prolia is an injection which is given by a healthcare provider twice a year. Then in estrogen replacement therapy, we have the medication which is known as Avista. This mechanism of action of raloxifene occurs through binding to estrogen receptors. This binding results in activation of estrogenic pathways and blackade in tissues that express estrogen receptors. So the basic recommendation for the tablet Avista is it is a dose which is recommended 60 mg orally each day. Most common documented adverse effects of raloxifene are hot flashes, flu-like symptoms, muscle spasm, and arthralgia. Less common effects are insomnia, vomiting, sinusitis, deep venous thrombosis. So the other medication for osteoporosis is testosterone replacement. In some studies, osteoporotic men undergoing TRT have been shown to have increased bone density through BMD does not reach male levels. Testosterone and its androgenic metabolite dihydrotestosterone exert biological effects directly through binding to the androgen receptor and indirectly through aromatization of testosterone to estradiol, which allow several side effects, which are irritation, redness, pain, tenderness, swelling, toughening, or bleached gum. There are some other side effects of this therapy, which are stinging or swelling of lips, unpleasant or bitter taste in the mouth, difficulty tasting food, headache, acne. So, in testosterone replacement therapy, we got the medication testosterone, which is given a capsule a day by the physician, depending upon the condition. And we also got the injection in this category, which is given 1 ml once a week. So here we have a column of drugs. indicating their class, dosing, and mechanism of their works and side effects. So we got biophosphonates, and these are lantonates, and their dosing is daily or weekly tablet or weekly effervescent tablet that should dissolve in water. So how these biophosphonates work? These strengthen bonds by slowing the rate at which osteoclasts move bonds. So these do have some side effects, which are gastrointestinal problems such as trouble swallowing, inflammation of the esophagus, and ulcer stones. Then we have ibentronate in biophosphonates. Its dosing is monthly tablet or injection every 3 months, and its mechanism is it's a strengthened bonds by slowing the rate at which osteoclasts move bonds, and it's have side effects which are fracture of the thigh bone, which are more than 5 years of use rate. Then we have risodronate. Its dosing is daily, weekly, or monthly, a tablet, and it strengthens bonds by slowing the rate at which osteoclasts move bonds, and its side effects are irritation at the site of the injection. Then we got calcitonin, and its drugs are calcitonin, mia, calcin, 40 cal. Its dosing is daily nasal spray or injection. It works by inhibiting bone removal by osteoclasts and increases the rate of new bone formation by osteoblasts. Its side effects are allergic reactions, small increase in cancer risk. Then we have parathyroid hormone, and its drugs are teriparatide, Forteo, and its dosing is a daily injection, and it works by increasing the number of bone forming osteoblasts. And its side effects are leg cramps, nausea, dizziness. Then we have monoclonal antibody, and its drug is denosumab. It is an injection given by a healthcare provider twice a year, and it works by preventing the development of bone removing osteoclasts. And its side effects are low blood calcium, skin infections, and rash, fracture of the thigh bone. Then we have other medications such as Forteo. Forteo is a prescription medicine used to treat postmenopausal women who have osteoporosis. Forteo is a prescription medicine used to treat postmenopausal women who have osteoporosis, who are at high risk for having broken bones, or who cannot use other osteoporosis. Then we have Timlos, which is another medication for osteoporosis. Its dosing is 80 mcg or 40 mcl, and 30 daily doses of 80 mcg. It is given in 30 daily doses. Then we have miacalcin. It is a nasal spray. So we have discussed that it is given miacalcin. It is given through the nasal spray daily, or depends upon how your physician has prescribed it. Then we have calcium D nicomate. Calcium D nicomate regulates calcium and phosphorus metabolism in the body, decreases reabsorption and increases bone density, and filling the back of calcium and vitamin D3 in the body. Calcium is involved in the regulation of nerve conduction, muscle contraction, and is a component of the blood coagulation system. Vitamin D3 decreases calcium absorption in the intestine. The use of calcium and vitamin D3 prevents the increase in the production of parathyroid hormones. And here we got some of the prescriptions given to the patients depending upon their conditions, and by physically examining them, and by having some of their tests. So one of the prescription is oleutronic acid 4 to 5 ml, and other is prolia, which is prescribed 60 mg to 1 ml twice a year. And the other one is Avista 60 mg tablet, and it is given one tablet a day, again depending upon the condition of the patient and their physical examination, how they were physically examined by the physician. And then we have Forteo 20 mcg to 2.4 ml. So it is one dose 20 mcg a day. Then we have calcitonin salmon 3.7 ml nasal spray, and it is given one spray into one nostril a day. and then we got calcium D3 nicomide tablet, and it is one pill 2 times a day. So this was all about effects of drugs on osteoporosis, and thank you very much.